Hello, welcome to The Hill's Coronavirus Report. I'm Steve Clemons, editor-at-large of The Hill. We're here with Ambassador Mark Dybul. Mark is the former AIDS czar for George W. Bush, responsible for implementing PEPFAR through much of the world, saving literally millions of lives, is now the co-director of the Georgetown Center for Global Health and Practice. Ambassador Dybul, thank you so much for joining us today. Let me just ask you to give us a snapshot from someone who understands the spread of pandemics and what they're doing. What is America getting right now? What should we take heart in? And what gives you pause?
Well, the fantastic, and good to be with you, Steve. The experts, the career people, thank God for Tony Fauci, Deb Birx, Bob Redfield, people I've known for 25 years. Tony's my mentor. They're really steering the course in the best possible direction. What we need to do now is get as many possible test kits out and test as many people as possible, because if we don't test, we don't know where the virus is going or what it's doing in our population. Once we have those tests out, it's a little late for us to do what South Korea and Singapore did, but at least we can catch up on the contact tracing and quarantine. But the main thing we need to ensure is out there now is the health supplies to protect healthcare workers and people, and also the capacity to treat people, because we know we have millions, or in all likelihood, millions of infections, and we'll have to wait and see how many of them need intensive care.
What is your confidence that those test kits are being rolled out the right way now?
I don't have enough visibility into the numbers and where they're going, so I will have to trust the people I know and believe in who are running the response. But there are two types of tests. There's a test that looks for the virus itself, which we need to get out, in part to understand the genetics, and we can come back to that, because a big concern is the mutation rate of this virus, but also a serology test that will be able to test people after they've been infected, because we've gotten so far behind on testing for the virus itself. In the coming months, we'll need to do really a national surveillance to understand how many people got infected and responded and created what we call antibody, which we can measure after the infection, rather than what we're testing now, which is for the virus itself during infection.
Ambassador, you wrote a piece for The Hill recently in which you argued that America's public health is linked to the other parts of the world that are out there, particularly lesser developed countries in the Southern Hemisphere, which may suffer what we're going through now more virulently in our summer, their winter. What is that connection, and why does it concern you so much?
Well, the connection's crystal clear, I hope, to everyone now. And this is a global pandemic, one that really no one alive right now has experienced. We've had things that looked like it could be. For example, in 2009, the swine flu. There was a concern about SARS and MERS. But really, this is the first time we've had this. This is like 1918 and the flu epidemic of 1918. So what we know is that the virus is all over the world. It's not just in the United States. And if you just look at China, as soon as they started to lift restrictions, virus came back, because the virus is all over. So unless we close our borders indefinitely, not only to the outside countries, but within ourselves, we will likely see sporadic outbreaks of the virus. But what's really concerning, and this we do not know, and is something we absolutely need to know, is this a seasonal virus? Most coronaviruses are. And that's related to humidity and temperature, but also during warmer months, people naturally socially distance rather than being confined in closed spaces. And so, for example, influenza, we all know, is a seasonal virus. Will this also be a seasonal virus? But that would mean that as countries head towards winter, including where we already have virus in the deep southern hemisphere below the equator, they are going into winter, they have virus. So if it is seasonal, we need to understand what's happening in the south, what's happening with the number of infections, southern hemisphere, and what's happening with the genetics, because we know the virus is changing at a fairly rapid rate, so that we can be prepared for our fall and what could happen in the fall. If we don't understand what's happening to the virus throughout the world, and it is seasonal, if it comes back in the fall, it could be more deadly, more virulent. And if we're not prepared for that, we're in deep trouble. So we need to understand what the replication rate of the virus is where it's going and how quickly it's mutating. Are those mutations related to being more infectious or more deadly? And that's what we think happened in 1918. The first wave in the spring of 1918 actually caused very few deaths. Many people were infected. And then it moved and followed the troops down along North Africa through India, back up through China. It was in the second wave, starting in August, September, that killed so many people. And the third wave again in the January, late December, January of 2020, 1919. So we really need to understand what's happening with this virus throughout the course of the summer, even if it trails off here. But I would also emphasize, as China is seeing, because we will have people traveling to the United States from countries that will have ongoing COVID, we are likely to see sporadic spikes throughout the summer. And so our health is the world's health. And if we don't see that connection, we are in deep trouble and walking blind into what could be a repeat or something even worse in our fall.
You and Tony Fauci were both heroes in the story about HIV/AIDS in Africa and elsewhere in the world, and not completely eradicating it, but dealing with it and bringing it into a controllable level. You've also been involved with Ebola, Zika, SARS. What are we not doing that we need to do that you saw as relevant in those global pandemics?
Well, you know, HIV is much different because it doesn't spread in the same way. SARS and MERS, avian influenza, really never got out of regions. So what we could be doing is studying what those regions have done. So South Korea, Singapore, China could have, because they put the systems in place, have a response because they built those off of experiencing SARS and MERS. Again, we haven't had that experience before. And really, that's putting in place very aggressive case detection, meaning having all the test kits available that we need, contact tracing as soon as you identify a case, and widespread testing, not just of new cases, but any contact around them or in the surrounding environment, quarantining aggressively once you've identified through that contact tracing anyone who is positive or at high risk of being positive, and then having the backup medical supplies, including respirators and things if the epidemic gets out of control. So if you look at what South Korea and Singapore did, that's what we should be doing and preparing for the fall. But if we don't know what the virus is looking like over the summer, we can't possibly prepare correctly. You know, Tony was my mentor, and we were fortunate to work on some things together. He's the real hero, but there's much we can learn not only from past epidemics, but what's worked in this epidemic so that we can be prepared for the fall. I want to emphasize that what we need to do after it starts to abate in this country to really be engaged in the Southern Hemisphere, in Africa, Latin America, is not just about supporting them to prevent infections.
Right.
If they can't prevent infections, that has a direct impact on our health. So global health security is truly global, and I hope this epidemic gets that through our heads. Otherwise, we are at risk for the long term. Not just this is not the last pandemic we're going to see in our lifetime.
We've seen some rumors of a spat inside the White House about hydroxychloroquine and about, you know, the way we should be stockpiling, certain therapies, certain drugs in this. As a scientist, as a doctor, as a global health leader, is that the right strategy? Is it something we should be doing, or we should be suspicious of quick fixes?
We should definitely be suspicious of quick fixes. You know, science has its methods, and they can be a little bit slower than people like. But if we don't know, and I'm just following Bill Gates' op-ed here because I'm not inside the conversations of the U.S. government, so I'll just follow Bill's. If we don't know something works, stockpiling it or telling people to use it can be dangerous. And very importantly, that drug is life-saving for people with lupus. If they can't get that drug, people are going to die from lupus as we're stockpiling something that might not work at all. So, you know, the world is moving aggressively, and under Tony's leadership, the U.S. government is moving aggressively to develop treatments and vaccines. But until we know they work, using things that don't work can be dangerous. And let me just give you some frightening examples. I mean, in Turkey, I don't think this is still the case, but at one point they had more deaths from people ingesting isopropyl alcohol than they had from COVID.
Right now, the United States is not under total shutdown order. Should we be?
I have to leave that to the experts, and what total shutdown looks like, it looks different in different places. If you have sufficient testing, contact tracing, quarantine, then you can manage. Singapore, South Korea never closed everything down, but we're too late for that approach. So, Bill Gates has recommended a total lockdown. I really have to leave that to. But
Tony, isn't there just something screaming out at just real life where we don't know what's going to happen in New York? It's a nightmare story, and of course, the Surgeon General has said that we've got some of the hardest days, the most difficult days for Americans ahead as they see what will be a living hell, essentially, for many in places like New York City. But a glimmer of hope that the number of cases that are coming online, that rate of increase is declining compared to what they now say about a place like Florida, which did not shut down beaches, and see that the potential peak there is until late May. Aren't we seeing a real live experiment where states that haven't shut down, that haven't imposed these distancing orders, are going to get walloped later?
Well, we saw that. We had the example of China as well. Look in San Francisco, where they did move into social distancing rapidly, even before the shelter in place, and they have a much lower caseload. So there's no question that states that are not have not implemented the orders that others have followed is putting their populations at risk. There's absolutely no question about it, because we got behind. We couldn't do what South Korea and Singapore did because the epidemic is widespread. I mean, South Korea, which has done the most testing, or Germany, South Korea has said that they believe they have 10 infections for everyone they've diagnosed. So if you look at that in the United States, that means we're somewhere around 4 to 5 million, because South Korea tested a lot. We haven't tested enough, so we're probably more than 10 to 1. So there are a lot of infections. There are a lot of asymptomatic infections. Young people can be carrying asymptomatic virus around and spreading it all over. And we don't. These are things we need to know, and know quickly. And the only way we're going to know them is getting massive testing out as quickly as possible during this phase of the epidemic. Then be testing with the serology test to look for how many people actually were infected, so that we can plan for the fall. But if we don't have those pieces in place, we could be in trouble. But importantly, we have got to do the same thing. We have got to support the Southern Hemisphere to do the same thing, or we will be flying blind into next fall.
I'm interested in the regular person at home, or in the a studio apartment somewhere locked down for weeks on end, which is the case right now in some parts of the country. You study health practice and impact, and it's not all about viruses. There's also elements of depression and social connection. And I'm interested in what insights you have that are useful to people watching this show today, what thoughts you have on how people can keep other parts of their health vital and in place, and not, as they keep themselves distant from a virus, that they aren't in fact turning on other problems.
Well, I have to be careful here, because I know viruses and I know bacteria, and I know how they spread. I'm not a psychologist or a behaviorist, but we've had to engage deeply in behavioral practices around HIV, TB, malaria. The one thing we know is that we cannot ever defeat a pandemic without deep engagement of the community. And communities all over this country and all over the world are solving and creating solutions to these problems. So whether it's Italians singing from their balconies, or people doing exercises online, we found personally ways to do it by doing FaceTime and staying in touch with people. There's a difference between a phone call and seeing someone in person with that connectivity. The shelter and order places allow people to get outside, get a little exercise, get some fresh air. But I would say the solution to this is for us talking heads in capitals not to solve that problem, but actually be now reaching out to people in the communities to be asking them, what do you need? How will you respond? And build those networks. And if we trust them, they can solve the epidemic. They can also help tremendously with contact tracing, with case identification. This is what we know, what we learned from Ebola. This is how Singapore and South Korea did it. Let's
Right.
engage our communities now. And we can do that in this country much more easily than other places because of the massive use of technology. I mean, my father
Right.
can actually be connected. He's more
Right.
connected than I am.
Well, we'll have to leave it there. I want to thank you for joining us, Ambassador Mark Dybul. Thank you so much for joining us for this edition of the Hill's Coronavirus Report. Thank you.